Hi, I'm Dr. Truman. Welcome to our office and congratulations on getting started with your orthodontic treatment. You're on your way to a new, beautiful smile. Our goal is to give you the best experience possible, but we can't get there without your help. Here's Kelsey with a few tips and tricks to help you along the way.
Thanks, Dr. Truman. Hey everyone, that's right. In order to get that great, beautiful smile at the end of treatment, you need to take good care of your braces. First things first, let's get you familiar with the most common parts of braces. There are many different parts, and as they act together, will straighten your teeth. The most obvious part is the bracket. Brackets are the individual attachments bonded to each tooth. This is an arch wire. It is engaged into each bracket, and it is actually what delivers the force to move your teeth. An elastic tie or O-ring is used to hold the wire into the bracket. You will get to change these ties at each adjustment, so you can personalize the brackets to your own unique style. Different from an elastic tie or O-ring is a steel tie. A steel tie delivers a stronger force to help engage the wire into the brackets where necessary. Proper oral hygiene is a critical part of orthodontic treatment. As you eat, your teeth and braces collect food, which will eventually turn into plaque if not removed. If this plaque or debris is left on or around your braces, it can lead to decalcification or scarring, which is permanent. To avoid this, make sure to tilt your toothbrush down towards the area between your gums and brackets. This is where plaque accumulates most. Next, tilt your toothbrush under the arch wire towards the gums. Make sure to brush your gum line as well. Then, with circular motions, brush the tops of your braces. Don't forget to brush the biting surfaces, behind your teeth, and of course your tongue. Dr. Truman recommends brushing 3 times a day or after every meal for at least 2 minutes. Remember, clean teeth do not decay and healthy gums do not swell or bleed. Your braces and appliances should shine when you are finished. Now let's talk about flossing. In order to floss with braces, you will need to thread the floss under the arch wire. To do this, you can use a floss threader or super floss. Once you've threaded the floss under the arch wire, make sure to move the floss up and down, hugging each tooth, making a C shape. Repeat this process until you have cleaned in between all your teeth. This does take a little time and a little practice, but doing so can help shorten treatment time, so it is well worth the effort. This is a proxy brush. This special brush is used for those hard to reach places. Gently place the brush under the arch wire and clean around the bracket. These brushes are also great for when you are out and about with no access to brushing. Don't forget to see your dentist at least every 6 months with braces for regular cleanings and checkups. This will help ensure we aren't missing any spots with braces and we don't encounter any surprises when the braces come off. Now that you know how to take care of your braces, let's talk about what to do if you encounter a problem during treatment. If something happens to your braces, remember it is usually not an emergency unless pain or discomfort is involved. As you are getting used to your braces, you may experience some sore spots on the inside of your cheeks. If this happens, you can use wax to cover the area. To place the wax, take a small piece and soften it between your fingers. Place it over the area causing discomfort, and don't forget to remove the wax before eating and brushing. If you happen to break a bracket or feel the bracket sliding on the wire, call our office and we will get you scheduled accordingly. These appointments often require more time and usually can't be done after school or at your regular adjustment. If a wire comes loose, you can take a pair of tweezers and try to insert it back into the bracket. Or, as a last resort, you can clip the wire with a pair of nail clippers. Just be sure to check with our office before doing so. Until your mouth gets used to braces, it is normal to feel a little sore. Over-the-counter medications such as Motrin or Tylenol may be used to help ease discomfort. Remember to follow the manufacturer's instructions. There are a few harmful habits that can damage your braces and make treatment longer than estimated, such as chewing on ice, pens, and pencils. Picking at your braces can also cause major damage to your wires and brackets, which can result in your teeth moving in the wrong direction. There are also certain foods that should be avoided during braces. Foods that are hard like nuts, hard candies, hard breads like pizza crust and chips can knock brackets loose. Even sticky foods like gum, caramel, and taffy can cause damage too. Make sure to cut up foods like carrots and apples into small bite-sized pieces and cut any meat away from the bone. Now that you understand everything about your braces, let's talk about how often we'll be seeing you. Expect to schedule your appointments every 4 to 8 weeks. Scheduling your next appointment before you leave our office is very important. Waiting to schedule until 1 to 2 weeks after your last adjustment complicates the schedule since appointments book 4 to 8 weeks in advance. Postponed appointments are a common contributor to overtime treatment. Don't hesitate to contact our office with any questions about your future appointments. Well, that's it. If you forget anything about this video or just want to watch it again, don't worry, you can watch it anytime. Just ask us how. In no time, you will adjust to your braces and feel great about your smile and progress. Just remember to follow these instructions and we know you'll do great. Right, Dr. Truman?
That's right, Kelsey. And remember, your assistant or I can answer any questions or concerns that you may have about your treatment. Congratulations. We hope you've enjoyed your experience so far, and let's work together to get that beautiful smile you deserve.